So if you are suffering symptoms, contact your gynecologist and talk about options. They may start you off with hormonal medications, but these can have significant side effects. Other options could include hysterectomy, which is complete removal of the uterus surgically, myomectomy, which is they're just selectively removing a fibroid, or what we offer, uterine fibroid embolization, where we go in through an artery in the hip, go and select the arteries and inject little tiny beads to decrease the blood supply to the fibroids. So a hysterectomy is a major surgery. It does require much longer recovery time compared to uterine fibroid embolization. There are possible complications such as injury to the ureter, which connects the kidney down to the bladder. Other complications could include bleeding or infection, but you should talk to your gynecologist about a hysterectomy and whether or not it's right for you. So myomectomy can be a good option if the symptomatic fibroid is just that, just one fibroid in a location that is accessible for single surgical resection while preserving the uterus. The uterine fibroid embolization, we treat the whole uterus with the blood supply on both sides. So it treats not just the one fibroid, but all the fibroids in the uterus. So UFE stands for uterine fibroid embolization. It can also be known as uterine artery embolization. We go in through an artery in the hip, and using little tiny tubes known as catheters and wires, we select the arteries to the uterus on both sides. We then inject little tiny beads into the arteries on the left and the right and significantly decrease the blood supply to the uterus and to the uterine fibroids.